My name is Peter Travers, and I'm the CEO of LifeBridge 10,000. We are pleased to show you our new proof of concept tumor treating field prototype. Tumor treating fields is an emerging cancer therapy already approved by the FDA for glioblastoma brain cancer and in clinical trials for many other forms of cancer. As we begin, I would like to explain the significance of what you are about to see. The effectiveness of tumor treating fields can be shown on a graph. Here on the y-axis, we're illustrating the rate of growth of a tumor. On the x-axis, we are representing the intensity of the tumor treating field in volts per centimeter. When you introduce a tumor treating field at the rate of 1 to 1.5 volts per centimeter, the rate of tumor growth drops by 20%. However, the important thing to realize here is that even at this level, there are more tumor cells growing than are being killed. When you increase the intensity to 1.75 volts per centimeter, the rate of tumor growth drops by 35%. It is not until the intensity of the tumor treating field gets to 2 volts per centimeter that the tumor growth rate drops below 50%. It is at this level of intensity that the tumor will eventually be eliminated. But look what happens when the intensity of the tumor treating field is raised to between 2.5 and 3 volts per centimeter. The rate of tumor growth is reduced by 80%. What if you could control this most therapeutic portion of the tumor treating field and make sure the broadest possible tumor reduction takes place? This is exactly what the LifeBridge 10,000 device is designed from the ground up to accomplish. To illustrate this point, here is the image of the tumor treating field in a 3D simulator called Sim4Life. The most therapeutic portion of the field is obvious in the middle of the tumor treating field array. However, the portion of the lung we just highlighted in green is not getting a therapeutic field. The goal of fixed array tumor treating fields is to make up for these weak areas with additional targeted firings. Here we show a firing left back to right front. When we highlight the undertreated portions of the lung from the previous firing, we can see that much of the area is now covered with a therapeutic field. However, these areas do not receive a therapeutic field in either firing. Even fixed firing configurations that can deliver a therapeutic field to almost all the lung still fail to deliver the most therapeutic portion of the tumor treating field to as much as 30 to 40% of the lungs. For millions of patients, this doesn't matter. They have isolated tumors and targeted delivery serves them very well. However, there are also millions who have diffuse disease that need a more comprehensive solution. Our device, called the LB10000, offers that more comprehensive solution. By controlling the most therapeutic portion of the tumor treating field and distributing it over a broad diseased area, offering more tumor reduction. Research shows that if you disrupt cell division using a tumor treating field, and then leave for a short moment and return, the cancer cells do not have time to recover. In other words, exposing a dividing cancer cell to a tumor treating field in short intervals has the same killing power as a constant field. An even more serious drawback to fixed tumor treating field arrays is when late-stage disease begins spreading in multiple locations. Eventually, you will run out of room to create targeted firings because you cannot put arrays on top of arrays. The LB10000 device overcomes this problem through its ability to dynamically assign array elements to any firing. Here, in the span of less than 1 second, the discs highlighted in blue were used for the liver, left lung, and peritoneal cavity. The prototype we are about to show is an engineering prototype. Actual devices are less bulky and are wired with low-profile flex circuit. Actual devices can be worn comfortably during daily activity. Here is our new proof of concept prototype showing that we can control the tumor treating field going through my body, similar to what we just illustrated. The device is now larger than fixed array devices being used in clinical trials for ovarian, pancreatic, and non-small cell lung cancer. The lights you see will not be active during actual therapy. We can deliver the field from different angles, which has been shown in preclinical studies to increase tumor reduction. This device is being built from the ground up for late-stage patients with diffuse disease, giving them the hope of high-quality extended life, as tumor treating fields has no harsh side effects other than minor skin irritation in some cases. You can make a difference by donating to our effort. We believe we can help cancer patients left without options. Why donate? Because they have more life to live.